Hi, I'm Dr. Jennifer Bailey, and I am a board-certified pediatrician and a fellow of the American Academy of Pediatrics.
Okay, so Dr. Bailey, thank you for allowing me to interview you today.
Of course.
And I know you visited Browns Ferry community last night, actually, and you were just talking to some of the community and churchgoers about some of the questions that they have surrounding the COVID-19 or the coronavirus.
Yes, sir. So we did a community event just to kind of help calm any fears or answer any questions that people may have. I know that there's a lot of information out in news media, social media about the virus. I wanted to dispel any myths that people might have picked up from especially social media, and also answer any of their questions to the best of my ability to give the best knowledge we can to some of our community members.
Okay. Speaking on the subject of media as such, some have criticized actually news media for addressing the coronavirus and spreading this kind of panic about the virus. What do you have to say as such?
I think that we all control our use of media. So sometimes some people have increased anxiety over the 24/7 news cycle, as you often hear it called. So some people don't know to limit that to control their own anxiety and fears. I think that it's in this day and age, the news cycle is 24/7. So if you want to consume media all day long, you can. Some people do have a more anxiety type reaction to that kind of situation when it comes to the virus. So I really think that you have to kind of gauge yourself to determine how much media you want to consume. Because if you want to consume it, it's out there. So I don't fault the media for doing their job, and I don't fault people for trying to get news from different sources and things like that. But if you are finding that it's causing you to be panicked or you're feeling more anxious, I would recommend taking a break for a little while.
And with such of a panic, one actually big topic that's been recently happening this week is the panic of crowd of people just going out and getting toilet paper for some reason.
So I think that everyone responds to potential issues with having to stay home or being homebound in a different way. So we've seen several shortages happen as a result of this virus. One is it's really hard to find hand sanitizer. It's very difficult to find some cleaning products such as Lysol, and then this week it was toilet paper. So I think that what people are hearing is that they could possibly have to stay in their home for 2 weeks, and they want to make sure that they have the essentials if they need to stay home for 2 weeks, and toilet paper is pretty essential. So I think that we're just seeing, almost as like we were seeing a store preparedness, we're just seeing people prepare for what needs to go on in their home. But remember that that only needs to be for 2 weeks. We don't need to prepare for 6 months.
And as a pediatric, you often work with kids as such. And so I saw the sign that actually has a sign that says, if your children are exempting flu-like symptoms, that they can call the doctors here.
Yes. So we're here for our families, and we want to all take very good care of our children. And anytime anything like this occurs, we always start thinking about how it will affect our most vulnerable people, such as the elderly and the children. So yes, if you are a patient at St. James-Santee Family Health Center, at our pediatric site at Georgetown Pediatric Center, if you have any type of worries and concerns about your child being ill, we ask that you call us first. The reason that we ask that is that we can do some screenings to make sure that we are not thinking that you might have a possible coronavirus infection. Because if you do, there's certain precautions we'll take to make sure that we don't spread it to anyone in the office or spread it to any of the patients who might also be here at the same time getting care. So what we ask, and what almost all doctors' offices are asking for, is instead of just walking in to get care, to give us a call. And that way we can make sure we're appropriately taking care of your child.
Okay. Because also another thing, Thailand Health has also announced that they're doing another precaution starting this morning where people with flu-like symptoms who are coming in, they can't directly come in, they have to go around.
Yes. So that is one of the ways that different places where you go to get health care can help reduce the risk to others who might be there at the same time. if someone were to have this infection. So at our sites at the health center, you might be asked to do something very similar, which would be to wait in your car and then us have you enter at an alternative entrance and go straight into an exam room rather than sitting in our waiting room with other patients.
Okay. And as a pediatric, have they found, I don't know, you don't have to know this or not, but have they found why this virus seems to be targeting mostly elderly people instead of children also, or is it?
So that's still a mystery. There's a lot of theories as to why children are doing so much better if they get infected with coronavirus in comparison to the elderly or people with other healthcare needs. Some people think it's because children often get colds, and the coronavirus family causes some of the common colds that we see in the community. That's totally different than the new player who is the coronavirus, the COVID-19 strand that we're seeing right now that's new or novel. But they're thinking there might be some protection because they've had those recent colds with other family members from the coronavirus family. But right now, there's no solid reason as to why, thankfully, children aren't seeming to have as many problems with the coronavirus as others.
Mm-hmm. And I just want to address this one last question.
Sure.
Last night at the Q&A, you did address how it might spread in the community, such as in the churches.
Mm-hmm. Yes, sir.
So I just want you to reiterate what you just said.
Yes. So you might hear a lot of things about what's called social distancing. What social distancing means is not having large groups of people get together. So a good example of social distancing is now the NBA, for example, has postponed the rest of their season because they can draw tens to thousands of people together in a small space. And anytime there's a large number of people in a small space, it's easier for a virus to spread in that area. What we're trying to do is by starting that precaution sooner than later of trying to not have big groups together is slow this virus down. So by slowing it down, we may not get a large peak of cases or a big explosion of people who are sick at the same time that won't overwhelm our healthcare system. It might be something that's a little bit softer of a peak, and that way we'll be able to allocate resources appropriately. What becomes a problem is when there's a large number of cases in a very rapid amount of time. That can put a stress on the resources. So use common sense is what that's going to come down to. If you're thinking about going to an event, or if you are in charge of something like a church, if we start seeing more cases in the community, you might have to think about alternative ways to either hold things virtually or to help eliminate people's risk of getting the virus.
All right. Thank you, Dr. Bailey, for
Thank
allowing me
you.
to interview you. Do you have any last minute things for parents or children?
Sure. So use common sense. The biggest thing that we need to really think about is washing our hands. Trying to minimize the amount of times you're touching your face. And to remember that masks might not necessarily protect you, but you may be asked if you have symptoms to put on a mask so that you don't spread things to others. But right now, good hand washing, avoiding those large crowds, and trying to limit the amount of times you're touching your face is really good starts to kind of slowing this down and reducing your family's risk of getting the virus.